Hello there, folks. This is my brain wreck. How you doing today? Well, just want to give you a little update about myself real quick here. I actually got officially diagnosed with epilepsy yesterday, so that was good news for me. Means I can go forward and get some more testing done also, which eventually is supposed to have a 48 ambulatory EEG. And I did give some blood work and stuff. I had two blood vials drawn, one for just my medicines or whatever, and one for my seizure meds to see if they need to lower it or up it or whatever. So far, my medicines are under control. So, my last video I told you I was going to talk about, VNS. So, basically, VNS is a vagus nerve stimulation. It's kind of like a pacemaker, you could say. So, basically, it's a implantable device to stimulate the vagus nerve in your neck, which is, I believe, it's right over here. And a lot of people in criminal justice learn about that, and they're practicing stuff or PPCT and pressure point control tactics. They learn about that in there, stuff like that. So it's electric impulse that basically travels to your brain. So from pulse up in your brain to keep it working the proper way, or dispersed to different areas to change the way the brain cells work. It's sometimes called a pacemaker for the brain, as I mentioned. It's approved for treat difficult to control epilepsy, depression as a rehab, and for stroke. So they use it for stroke also. And sometimes they use it for, I'm going to say heart attacks? Not heart attacks. I can't remember. But, anyways, for obviously epilepsy and other things. So it's a type of neuromodulation, which is a treatment that alters the activity of nerves. Because when you have epilepsy and stuff, and you go to have seizures, your nerves and stuff or whatever they go out through your body, connect to your brain, mess your brain up, and you're gonna act all kind of funny. You lose all control of your mouth body functions. And like I said, you can pee yourself, defecate yourself, which is very embarrassing for some people, obviously, you know. But unfortunately, they don't have control of that. We don't have control of that. What happens to our body? So, this nerve stimulation involves implanting a device that sends regular mild pulses of electrical energy to your brainstem. So, your brainstem, that's back here. I can't quite remember. Somewhere up there. Through your vagus nerve in your neck. After reaching your brainstem, the electrical charge is discharged to different areas of your brain to change the way the brain cells work. I'll make a disclaimer here. I'm not a medical professional or anything like this. I'm just passing on information for you guys that you want to know and stuff about epilepsy and seizure disorders. And as I mentioned in my other videos, there's over 40 plus different types of seizure disorders. That's just for information purposes only. And we'll go into other seizure disorders and things like that. But also be aware, I'm not a medical professional. I'm not a doctor or anything like that. If you need any medical advice or anything like that, seek that from your medical team, okay? I'll make sure I put that in my description each and every time when I upload stuff or if I'm talking about it. So after it reaches that areas of your brain, the VNS, to change the way your brain cells work. So the vagus nerve stimulation works like a pacemaker for your heart. In fact, VNS is sometimes called a pacemaker for the brain. So it's called pacemaker for your brain. Now this video isn't going to be as long as my other videos, but it might be, might not be. We'll see. So it's a treatment option that you and your healthcare profession might consider after other traditional treatments haven't been successful. And usually sometimes they use these because people become resistant to medications and stuff, to their epilepsy medicine, to their anti-seizure meds. So that's why they might use that to help lower the so their threshold to seizures aren't so as bad. So the use is limited to a select group of individuals who have treatment resistant epilepsy, as I mentioned, or treatment resistant and depression. More recently, VNS has been approved as a rehabilitation aid for select people who have had a stroke. All right. So, where is the vagus nerve and what does it do? Well, your vagus nerve is one of 12 pairs of cranial nerves. So, cranial up here, obviously. I think your vagus nerve is on the left side of your temporal. Can't remember. Your left temporal brain is a cranial nerve and is the longest cranial nerve. You have one vagus nerve on each side of your body. Okay, on one each side. Both start at your brainstem and pass through your neck to your chest and your abdomen. So, okay, so that's something new. starts in brain, your neck, and chest, through to your down to your abdomen, somewhere in there. So your vagus nerve is a part of a circuit that links your neck, heart, lungs, and abdomen to your brain. So, what does the condition vagus nerve stimulation treat? The U.S. Food and Drug Administration has approved vagus nerve stimulation to treat 3 medical conditions for use in epilepsy. VNS is approved as an add-on therapy for focal partial seizures in adults and children 4 years of age and older when medications haven't controlled their seizures. And as I mentioned just a little bit ago, people are resistant to medications and this just doesn't work for them or anything like that. And from things I read and stuff and done my research and stuff, on a group online, it seems to help people, quite a few people and stuff, and lessen how many seizures they have a day. So that's pretty good. That's also used for depression. So Venus is approved for adults 18 years of age or older who have long-term or recurrent repeating major depression that hasn't responded to 4 or more antidepressant treatments. Now, for those in the stroke rehabilitation, it's approved as an add-on to rehabilitation therapy for people who've had moderate to severe loss of arm and hand function due to ischemic blood flow or stroke. Now, as for myself, I have what's called a polycythemia, which means my body makes too much red blood cells in my bone marrow. So that's what it leads to where I could possibly have a stroke or anything, possibly, So that's one reason possibly why they can use it. Also, my polycythemia, I guess you could rate this a certain way, but I don't know if I don't think I would need a VNS or anything, but basically what I'm supposed to do is take a baby aspirin each day, whatever, and possibly have my blood drawn every so often, so I can just check my blood work, which supposedly helps out thin out my blood or whatever, and not produce as much red blood cells. It can always also be from low oxygen levels also. So how does it technically work, the nerve stimulation VNS work? Well, researchers don't know precisely how vagus nerve stimulation works as an aid to control seizures. So basically, they think it to improve blood flow to critical areas of your brain of the chaotic electrical pattern that happens during a seizure. Because the electrical pattern is just going all crazy around in your head there. Like I said, your brain doesn't know what's going on. You're getting the wrong signals. And so traffic's crossing the wrong way. So they increase the level of neurotransmitters, specifically norepinephrine and serotonin, stuff that's found in antidepressant given to you in your brain that may control seizure development. So as an aid to manage depression, VNS is thought to alter the level of specific neurotransmitters in your brain that play a role in regulating mood. As an aid for stroke rehabilitation, VNS is thought to stimulate the motor cortex area in your brain, which controls your ability to move your arms and hands. So I don't know if you already know how to recognize a stroke. If you're trying to recognize a stroke on somebody, you ask them to smell. Because they're trying to smell, their mouth might go crooked like that, because you want them to see their smile or hold their hands out a certain way. If their hands aren't moving a certain way, you're supposed to. I can't remember exactly how you're supposed to do it, but it's been a while since I've done that type of training. So what does it feel like to have a vagus nerve stimulation device? Well, myself, I do not know what it feels like because I do not have one. You're usually unaware when the device is on or feel the stimulation. However, you may have a tickling feeling in your throat or neck. Your voice may become hoarse or you may have a mild cough when the stimulation is on. So I'll be right back with you guys in one moment. Now I'm just continuing more from here. Of course, I am reading from Google and stuff here and do my research and stuff on there also. So I get my information. That's why I say this is just for information channel only. That's still called my brain, right? I do understand some of it and stuff, a little bit here and there. Now it says the stimulation bothers you in any way, call your healthcare provider. They can adjust the programming to lower the amount of stimulation, obviously. Now, which people should not receive the VNS? You may not be accounted for the vagus if you're pregnant, have breathing problems such as asthma and stuff like that. I myself have asthma a little bit, including asthma, sleep apnea, chronic obstructive COPD, basically, or other lung diseases and disorders. Have an active peptic ulcer disease, have insulin-dependent diabetes and mellitus. I have type 2 diabetes. Or if you only have one vagus nerve, there are people that have one vagus nerve, or if you have dysautonomias, which involves the normal functioning of your autonomic nervous system. And once again, I'm not a professional in medicine or anything like that, or a medical doctor. I'm just doing this information to pass on if you guys are interested. This is my brain wreck. That's why I call this channel my brain wreck, because my brain took a wreck. Some of you that have epilepsy or seizure disorder, I'm sure a lot of you guys can relate. Or if you're receiving other forms of brain stimulation. Remember, it's not just the VNS, there's also the RNS, which is a totally different thing, which maybe I'll talk in the next video. If you have heart arrhythmias or other heart abnormalities, it's not good for you. Now, another thing is, this is more on the psychological side. Have a history of schizophrenia or schizophrenia affective disorder. Now, schizoaffective disorder means that you're in between the two, whether, you can just switch like that real quick like that. Or the schizophrenia means you're right there on the edge, but you're not. Are delusional disorders. There's different types of delusional, and there's something called I can't remember what it's called. I want to say snoriform or somewhere, where you're reaching for something and it's not there. Or rather, recycling bipolar disorder. Or you have had previous surgery to your left neck involving removing part of your vagus nerve, etc. So what happens before you have your nerve VNS put in? So before your surgery, your healthcare provider will perform a physical exam. You may have blood drawn to ensure you don't have any health problems that could cause concern, obviously. You don't want that. And I think that's for most surgeries. That's any type of surgery. Major surgeries, obviously, are going to do that. But of course, this is being connected through here into your brain and all that great stuff. So, surgery to implant the device can be done as an outpatient procedure. Some surgeons might recommend that you stay overnight, though. So, it's done. I don't even think it takes that long. I mean, it's a long surgery. It's probably, I'm going to say it's probably a 3 or 4 hour surgery, maybe. I don't know. I'm not for sure. So what happens during the vagus nerve stimulation treatment? Well, on the day of the surgery, I take an antibiotic to lower the risk of the incision-related infection. Obviously, you're going to get an infection. I mean, this is happening in a hospital environment, where you are going to get infections no matter what. You need to know how clean the hospital can be, or supposedly. So basically, your neck and chest are clean for surgery. You may have surgery performed under local anesthesia, so hopefully they can get that right nerve block playing in there. And I remember one time when I had surgery on my left shoulder, because like I said, my background's in criminal justice. So if you have any questions in criminal justice, please feel free to ask. That's what my background's in. I got tased once. I got tased another time for more training. And my tendons got loose somehow. My arm jerked so hard, I believe. And yes, they had people to catch me, so I wouldn't fall flat on my face, of course. And then we were asked what's called, if you want to ride the buffalo, the full 5 seconds. So I said, sure, why not? Full 5 seconds. So basically what they do is they squeeze the trigger and hold it there until it's done for its cycling thing. So, and yes, it is 50,000 volts, but mind you, the volts don't carry the amps. But also take into account, though, that people don't realize that when they use the defibrillator on you in the hospital, whatever, or Joules, as like the name of it's called Joules, Joules. It's way more voltage to use on your heart than it would be with a taser, believe it or not. So way more to shock your heart back into beat. So the vagus nerve stimulation. So you need to be given general anesthesia to keep you asleep, obviously, during the procedure. So basically, the nerve stimulation device consists of a vagus nerve stimulator, a pulse generator, basically like pacemaker device and a wire lead, insulated wire with electrodes at the end of the wire. So, I'm just explaining this to you guys in case you're just interested in passing on information. Yeah, you can look on all other tubes and so like other YouTube channels and stuff like that. But I thought I'd just start this channel just to see for you guys, for me to try to explain to you and try to explain in my terms and maybe the medical terms and layman terms the best how I understand it happens, how I can explain it. So basically, your doctor or surgeon will make 2 incision cuts. Probably one here and then probably one up here somewhere on the left side of your neck to expose your vagus nerve, and the other on your upper left chest. Okay, so right over here somewhere, right here, and then the coil electrodes at the end of the lead wire are gently wrapped around your left vagus nerve through the incision made in your neck. Your surgeon then guides the insulated lead wire extending from the electrodes from your neck and down to your chest and to the chest incision. It's almost playing doctor, like the game Doctor, where you gotta move stuff slowly and without touching part of the body. But this way, it's the opposite. It's going into your body. They then connect the end of the electrode to a battery. So basically, like myself here, I do have what's called a loop recorder down here right for my heart. Basically, it's a constant EKG. So it's a little battery is placed about 1 inch below my heart here, and I can feel it actually. So it just stays in there. They're not gonna take it out unless I want it to be taken out there. They just keep it in there until the battery dies. So the battery is a little bit bigger than a silver dollar. It goes through the incision into your chest into a pocket made over your muscle. So once the device lead wire and electrodes are implanted, the system is tested. The device is usually turned on at the lowest setting for 30 seconds to 90 seconds to make sure it's stimulating your vagus nerve. Your surgeon then tests the system. Finally, they sew the device to your pectorals fascia, a thin collagen layer covering your pectoral major muscle with permanent stitches or sutures. Alright, so what happens after the vagus nerve stimulation surgery? Well, basically just do a device adjustment and operation if need be. You'll return to your healthcare provider's office in 2 to 4 weeks to turn on the stimulator device, turn on the simulators, or increase the stimulation if it's already been turned on. The surgery is 45 minutes to an hour long, by the way. The device is programmed by your healthcare provider using a computer programming software and programming wand. The device will set to deliver electrical impulses, measure the strength of current to your vagus nerve at a certain pulse frequency, measured in hertz. So basically like the hertz that comes through your wall outlet, 60 hertz or so forth, for a certain length of time measured in microseconds to seconds, and a specific time on, time off cycle measured in seconds to minutes, because they want to have the right proper setting to go along with their vagus nerve and stuff and make sure everything's working properly. This all goes along with your whole body. Device is on our cycle selected by your healthcare provider, but you'll also be given a handheld magnet that can be swiped over the device to send extra stimulation to your brain if you sense a seizure is about to happen. So imagine having that extra one just to go, hold on guys, give me a second here. Maybe zap myself for a moment. Seems kind of weird, right? When used during home rehabilitation exercises following a stroke, swiping the magnet over the device activates it to begin the 30 minutes of stimulation. Holding the magnet over the device turns the stimulator off. Removing the magnet will resume your healthcare provider's program stimulation cycle. And some batteries for epilepsy, increase in your heart rate can also trigger activation. I remind you, this is not a cure for epilepsy at all. No way, shape, or form. It's just to help lessen the seizures and stuff and make the thresholds not lessen thresholds, but make sure your thresholds are not as bad. Make sure your thresholds are better. So after that, you need to see your healthcare provider to ensure the device is remained in the correct position in your chest and is working properly, obviously. Adjustments may be in the device programming if needed. Now, as I said, I remember I had a electro down here, a loop recorder, which I said is basically just a battery. It records my heart, whatever stuff going on, the bumps, the atrial, ventricular, and so forth. So it's just basically a battery put in here, but it does send information to the machine I have. Of course, I gotta be within 6 feet of it for it to work. I'm not in with it right now, but so this is done in small incision in your chest wall, obviously. So okay, so you need to have a battery replaced about every 6 years. Some batteries last as short as 1 year to as long as 15 years. When the battery level is low, the entire stimulator is replaced. This is done in a short procedure, only requires a small incision in your chest wall. So you're going to have to go back in, get the old one taken out, the new one put back in. It's just the battery, it's not the wires, I believe. So when that happens, you got to make sure you tell all your healthcare providers that you have a vagus nerve stimulator device before having any medical procedures or image testing, such as a MRI, obviously, because magnetic. Those tests can then revert through your device. So what are the risks and benefits with this? I know you guys see my ready face over here and stuff. I'm gonna do it. Turn this one off too. But as I was saying, so the common risks of vagus nerve stimulation include infection, pain, and inflammation at the incision sites, damage to your vagus nerve or surrounding structures. Then you wonder what the side effects are associated with the vagus nerve stimulation. Common side effects of vagus nerve stimulation include it could be coughing, hoarseness, changing your voice. So don't be surprised you hear your voice sounds like that's not my voice. It's because they cut you open and they're went down through your neck here and on your left side here, excuse me, up through your neck, and remember it looks all the way down here and goes so forth. Neck pain or throat pain or tickling, shortness of breath, trouble breathing, dyspnea, dyspnea was the fancy name, trouble speaking, which is dysphonia, trouble swallowing, dysphagia. Some people do have trouble swallowing stuff because some people already have a neural throat way and stuff like that, so it has trouble swallowing. So it could be that, or a headache. So if you experience those side effects, it may lessen or may become less bothered by them over time. If you can't tolerate the side effects, it might be possible to adjust the electrical impulse or the other device may be temporarily or permanently turned off. Now, for the serious side effects, include infection, Horner's syndrome. Please don't ask me, I don't know what that is because I'm not a professional or a doctor. Or vocal cord paralysis, so it can make maybe your cords getting tightened, I'm guessing, or loose. I'm gonna guess it makes them tighter. Muscle weakness in your lower face, facial muscle paralysis, paresis. Excuse me. Your heart may stop beating. You could go into cardiac arrest. It's possibly. So I'm not trying to scare you with that, but this is what it says down here. I'm not trying to scare you. So, but this is what it says on the risk benefits down here. Sudden unexplained death. Something like SUDEP, which is people that have epilepsy myself, is sudden unexplained death in epilepsy is what SUDEP is, but sudden unexplained death. This doesn't happen at a higher rate than naturally seen in a population of people who have epilepsy. Mechanical complications like a break in the lead wire or device malfunction. That could be a risk, obviously. So they're covering out now the benefits. You're asking about you're wondering about the benefits. The benefits probably are less seizures, more control, feeling better, maybe feel more of a stimulant, not as depressed, not as much anxiety, less stress, and so forth. Sorry. So what's the recovery and outlook time? Well, it's you can return to your everyday activities 48 hours after your device is implanted. Your stitches are self-absorbing, so they don't need to be removed. So basically, just stitches that will be going away. So what can you expect from the outcome from the vagus nerve stimulation? Well, in epilepsy, vagus nerve stimulation doesn't cure epilepsy, as I said. Probably won't completely stop your seizures, obviously, but it might lower the threshold. Not lower the threshold, make the threshold higher, and you won't have as many seizures. Either, and you'll need to continue taking anticonvulsant medication. So the goal of the Venus is to reduce the number, length, and the severity of your seizures. Now, this is that a 455 patient study showed a 50% or greater reduction in seizures, 37% of patients at 1 year, 43% at 2 years, and 40% at 3 years. All right. But anyways, we'll continue on from there. So when to call a doctor? Well, there are signs of the infection after vagus nerve stimulation device surgery. If you have these signs of infection, call your healthcare provider right away. Redness at the incision site that's not going away. Incision that's painful or sore to the touch. Swelling or fluid felt around the incision. Bad smell coming from the incision. Pus or drainage coming from the incision, which could be the bad smell, obviously. Hot to the touch, fever, chills. Yeah, if it's hot, you feel very hot stuff, more likely you just need to go straight to the hospital. Fever, chills. For all other problems or changes, should I call my health provider for? Uh, Constantly hoarse voice. Like my voice sounds hoarse right now, but I have water here because it's been hot out today and dry. Stimulation that becomes painful, causing choking, breathing, or swallowing problems, or changes your heart rate. Increased drowsiness. Signs that your device isn't working properly or the battery is low. Worsening of your health condition. So check with your healthcare provider before having imaging tests that might affect your VNS device, such as magnetic resonance imaging, or before you have any other medical device implanted. Now, vagus nerve stimulation has been shown to produce some anti-inflammatory properties. This has led to studies of VNS in such long-term inflammatory disorders as sepsis, lung injury, rheumatoid arthritis, diabetes, inflammatory bowel disease. It's also being studied in migraine, pain control and fibromyalgia, obesity, bipolar disorder, and Alzheimer's disease. So, now if you're wondering if the vagus nerve stimulator is covered by insurance, obviously you're going to have to call your insurance company. And to me, that's to be the very first thing I would do. Don't call the doctor, don't call that, call your insurance company and talk to them. Ask as many questions as you can and have them break it down for you. Even ask me to see if they can send you a preset bill, how much it would be if it was covered. And don't say they can't tell you. They can tell you, give you an idea at least. So, LVNS has, it's a FDA approval for use in epilepsy, depression, and as a rehabilitation aid after stroke. It's used in these medical conditions is specific and limited. You might need to meet certain criteria before your insurance company grants coverage. So, call your insurance company. That'd be the very first thing you do, call an insurance company. Because you and I know how insurance companies can be, like, no, we can't cover that. We can't cover this, and it can only be like a $2 piece. That no, we can't cover that because we don't know sure how that would work, or I think insurance companies are multi-billion-dollar companies. All right, just look at it that way. So are hospitals and pharmacies, right? I mean, they all kind of work together. So, are all vagus nerve stimulators implantable devices? No, they're external or commercial VNS devices. However, these external products can't match the frequencies and voltages used in the implanted devices. The electrical signals they produce have to pass through your skin and neck muscles. They're not precise enough to access and regulate the specific activity of your vagus nerve, as an external device isn't attached to your actual nerve. So, the long-term side effects of a commercial VNS devices they're not fully known yet. If you're interested in commercial VNS devices, it's best to talk with a healthcare provider specializing in this area. I myself rather have it internally, since it's been studied more. I would not have it externally because I'm afraid something would happen and I would just somehow get ripped out somewhere out of my sleep. So, and just so you know, this is all my information. I'm getting this from the Cleveland Clinic, by the way, just in case you're wondering where I get my information from. All right. So, and as I said, this is a note from the Cleveland Clinic. Vagus nerve stimulation using an implantable device to send mild electrical pulses to your vagus nerve, which then travels to your brain. If you have difficulty to control focal seizures, depression, or have limited upper arm mobility following a stroke, ask your healthcare provider if VNS might be a treatment option. All right. So this was last reviewed on 3/16/2022. It was medically reviewed by Cleveland Clinic. So I'll put the website in there. Just not Cleveland Clinic and whatever. You can search in the Cleveland Clinic. You can just search vagus nerve stimulation and talk about it that way. But anyways, I hope you guys understand this, and excuse me for my voice if it's not sounding all that great right now. But like I said, I gave you my update for myself personally. I'm finally very happy I got diagnosed with the epilepsy. I have nocturnal seizures. I mean, not nocturnal seizures, tonic clynx, which basically they are. Not in my sleep or whatever. So, in all 3 times, I've could have meet with the big man upstairs, especially the last one where I was put into a coma, not intubated. So I thank God that He wants me here still for something, obviously. So my work down here is not done. So that's why I got this right here. I know you can't see it, but over here it says Jesus right here. So, but other than that, guys, thank you for tuning in to my brain wreck. If you guys like my channel, like, subscribe, press that bell button for notifications. Make sure that bell is highlighted. That's filled in. Or click down on the bottom right hand corner of your screen. Yeah, bottom right hand corner of your screen down there. And click on the little character with the electrodes on them. Hence the epilepsy. So I just want to thank you. If you guys are new to my channel, welcome. Appreciate it. And if you still haven't found this channel yet, and maybe you happen to came across the channel, maybe there's a reason why you did come across this channel. So thank you for watching this. Appreciate it. This is my brain wreck. I'll talk to you guys again sometime soon. I do apologize. The video is long, so if you want to fast forward through things, you can if you want to, or just listen to my voice and my hoarse voice or whatever. Probably because I'm sitting in a funny way also. But you guys have a great night. Talk to you soon.